We're at Summer Place for the ITWeb and AWS Cloud Series 2022 event, surrounded by industry experts from the healthcare sector, sharing their insights with regards to using technology to improve health and the life of the citizen.
I think technology has made significant strides in the advancement of healthcare solutions. We've seen a huge uptake of cloud computing for the advancement of healthcare delivery and improvement of patient care. There's organizations that have used our cloud-based technology for the deployment and the distribution of medicine dispensing out into rural areas. So cloud technologies have provided organizations the ability to scale significantly and be able to use the consumption of cloud-based compute, storage, database and network at a very low cost, and giving the customers the satisfaction that those applications and the data that gets stored in the cloud is secure. Many organizations are wanting to be able to create digital channels for them to engage with their patients. The cloud technologies essentially provide a very low cost mechanism of getting access to technology to help improve those patient outcomes.
So at Beyond, we are currently using the AWS cloud platform to help us deliver the best service possible to our end user. We basically have onboarded over 110 countries, delivering vaccines from distribution level all the way to the end customer. And we want to provide the best service possible. And as we have grown as a company, there is no limitation in onboarding new customers, more IoT devices, to ensure that the vaccines we are delivering are 100% as they are temperature sensitive. And this ensures that the nurse can focus on her job of delivering correct vaccines to children, to mothers, to families. And we pride ourselves on delivering brilliant service, and this was only possible with AWS as a partner.
They are our strategic partner. We partnered with them when we founded the company in 2018, and we see them as the way in which we can reach 1 billion people across the African continent. I think it's important to understand that without the cloud, there will be no future in healthcare. The invention of Web 3.0 and the sovereignty of your data owned by yourself. So the ability to deliver a personal healthcare record onto a person's phone, and the entire longitudinal healthcare record sits on the patient's hands, that they can engage with any doctor at any time. The cloud is probably the most innovative sector for the health industry, in that it can deliver real transformation into all the areas that permeate through the healthcare industry.
Out of a writing pharmacy perspective, the cloud has really opened up a new world for us. Firstly, to innovate quicker, and obviously by doing that, we aim all our technology at last mile medicine dispensing and distribution, and the cloud only made us faster and better, and obviously improved our patient-centric solutions. We mostly operate currently in the public sector and merging into the private sector, but I think our collaboration with AWS, etc., has just enhanced our horizon to fast-track what we're doing in the public sector. But in essence, what we found is that in the environment that we're operating in, there's not a lot of data available. So we like to be seen as pathfinders to create data where there's never been data, or digitize data, to have a patient-centric approach to all that we do. So we've got a motto that we listen to the patient, not to give a solution, but to listen, learn. That's where the collaboration has been exciting, because a lot of the things that we've been doing has been invented and maybe used in different other ways. But I think, with a partner like AWS, it enables us to also listen and learn from them. So that is actually leapfrogging our solutions in the continent.
What we have is in silos at this stage. What is required is cloud infrastructure to put it together for us to archive it and use it as and when required, especially in real time. I'm talking about rural health practitioners. If they are able to get information about the patient who has been treated in a different facility, if it's on the cloud, that information can be used to manage the patient better. The key considerations are public-private partnership, public-private initiatives that can actually assist us. Because there's a lot of information that has been collected by the private sector and the information collected by the public sector, but we are not able to use that to our advantage because there is no integration. That's where the cloud technologies come in, and we have to work together. And I keep saying, whenever there's an opportunity, we have to have close collaboration between government, industry, the academia and the funders. Then it will work in a favor.
I think what's important for us at AWS is ensuring that we help improve patient outcomes through data-driven insights. We know that the healthcare industry is very much regulated, but they also sit on the wealth of data. and being able to get insights into that data to help improve those patient outcomes is where our focus is.
At AWS, we have formulated a Cloud Health Innovation Board to bring industry and technology partners together to solve health issues within South Africa.